from 40,000 to 90,000. So we want to talk about two state programs that could potentially help mitigate some of this impact, not address fully the impacts, but just wanted to lay out some way that we think we could try to make some type of impact. One of which we have more control over, and one of which we have dependencies on other state actors. So the first one is tying back to our health insurance affordability program. You know, as you recall, 2 years ago, was put in the fiscal code outlining the structure of a state affordability program, kind of anchoring into a $50 million level. So we remodeled that to look at what would that look like now if we had a state subsidy at about $50 million. What would the impact be, considering that we just saw 85,000 people drop coverage in 3 months? So on the next slide, here are the results of that updated modeling. So it is pretty impactful. From the model, it does indicate that we could potentially get 30 to 35,000 individuals enrolled at that $50 million level. Some of those would be getting people back who terminated. When we did our survey of terminated individuals, many, especially at the lower income levels, said they would come back if coverage was made more affordable. We have direct contact information for all these individuals, so there's also sort of a pretty low barrier to contacting them. If there was a state subsidy in place to say, hey, coverage is now more affordable, please come back in and take a look. We know who these people are. We know that they were enrolled. We know that they dropped coverage.
Just saying that outreach would happen during SCP or OEP, like getting them to enroll during the open enrollment period if they're not covered.
I mean, whenever, I think it really would depend on, it needs funding, right? So I think it would depend on if and when it was funded, but whenever it could go live, we could reach out to people. If it isn't an SCP period, we could, talk about creating an SCP for that, for people to come in specifically if they're now eligible for the affordability program, or if it's aligned with open enrollment period, we could also send targeted messaging to people that we know were enrolled this past year and dropped coverage. Obviously, the further out we get, situations may have changed. If it's something that's earlier, you might still be able to, people might still be uninsured and kind of looking for those options. This could also impact people who came in, signed up, looked at coverage, but didn't buy it because it was too expensive. We have all their contact information as well. Like, we know who came in and didn't buy at these income levels. So, we have, and I think that kind of feeds into the ability of this program, if it were funded, to be pretty effective in bringing people on to coverage. It's not necessarily like to go out and find uninsured people. We would potentially do that, but we also know a lot of them that have recently become uninsured. A program at this level could reduce costs really at those low income bands, which is about 280 to 290,000 enrollees. That's total inclusive of people who are currently in those income bands, plus that additional 30 to 35,000. And the benefit that would be seen there is then being able to buy back up to silver and reduce those thousands of dollars of out-of-pocket costs that are now higher with higher deductibles by going to bronze. So we would have a pretty, meaningful impact there in being able to give people more purchasing power for the level of coverage that they have. We have estimates of, and all of these are ranges because it really would depend on exactly how it's set up and the amount of money that went into it. But we, modeled a few different scenarios, and they all kind of centered around these numbers. So it could reduce the average premium for these individuals around, to 12%, and it would reduce the morbidity, kind of expecting that it would bring in healthier people, assuming again that healthier people are more likely to drop in the case of higher premiums, and the sicker people are more likely to stay. So wanted to share, this is pretty hot off the presses. We sort of just did this modeling in the last couple of weeks, so wanted to share it here of just what this program could do if it, were funded at some point, which again is sort of outside necessarily just the Pennie program, but really just looking at what the impact would be. Any questions on David? Go back a slide.
I guess just what's the volatility of this actually having an impact on consumers based on rate changes year over year? I'm just asking because you do business in New Jersey. I saw more complaints from New Jersey consumers that have a state-based subsidy about the increase in their rates than I did in our PA population. Like they were harder hit and there is a state-based subsidy. So, I'm just curious as to how volatile that will be and the real impact. Is it a drop in the bucket or is it a meaningful difference in out years? With how things can change year over year to where the second lowest silver is and all of that. Like, how does that all play out?
Yeah, I mean, the second lowest cost silver plan does create volatility no matter in a state subsidy, no matter whether it's New Jersey, which is flat fee versus this model, which is more percent of income, kind of building off of the APTC approach. So I think that, I don't know if that answers your, I mean, there is volatility. And I think part of what we modeled was a lower than $50 million spend to account for that volatility. And that is what we had done in New Jersey as well, as we modeled out something lower than we wanted to spend to leave some buffer room for volatility. Just a side note on the other, I will say we heard from several states that a lot of people did call in at the beginning of open enrollment very upset about the rate increases. Just a note to the benefit of how early and often we communicated. We didn't hear that as much from our call center. A lot of people called in already knowing that the costs were going to increase and why. And so just kind of calling back to the effectiveness of communicating early and often is that we were expecting to get a lot of those angry calls, and we got a lot of calls, but the temperature was not as high as we were expecting, because by the time people called in, they had sort of already seen 25 of our days to them. Does that answer your question though on the model?
Yeah, I mean, I guess I'm just trying to understand the long-term feasibility of something, because it's obviously a big expense for the state. There's a lot of pressures on the state budget too. So just trying to, I guess, understand the bigger picture a little bit, and then what in reality, how impactful this is or isn't.
Yeah, I think
a big question. I'm just trying to understand it a little better.
Yeah, I think I would two thoughts on that. One is, so with state subsidies, the more you put in, the more you get out. So the more money put in, the more of an impact it makes. We've seen that pretty directly with the enhanced tax credits as well. So $50 million is enough to be meaningful, especially at the lower, like from this modeling, it shows it's enough to be meaningful, especially at the lower incomes, where it takes a relatively small dollar amount to kind of flip someone from it being unaffordable to being affordable. But I think 50 million is sort of the minimum of effectiveness. You go below that and it's kind of losing its ability to move the needle there.
But I guess I'm looking at, like, if we looked at this before the enhanced subsidies went away, I guess it's almost like pre and post that. Like, that's probably the biggest shock that we'll ever have to what people are paying. And I guess if we modeled this out and saw this is what it would look like for this person when they had the enhanced subsidies, this is what it looks like now. Is it taking their premium that previously it would have gotten them basically, ultimately for free? Now the post enhanced subsidy, no enhanced subsidy world, they're now paying $100 or $150. Is that taking that $150 down to, $130, or is it taking it down to $25, right? Like, I guess I'm just trying to understand, like, I think we need some examples to just, I don't know, maybe that's just me, but.
Yeah, and we did have a couple of different things run. They were all sort of splitting the difference between current and enhanced tax credit. So like before, people paid 0% of their income and now they're paying 2%. This would sort of get them to a 1% cap. So it kind of, for the FPLs we talked about before, kind of that really focusing on 150 to 250, but with a little bit above and below that, kind of splitting the difference between the two funding, the two tax credit levels.
Have there been any meaningful conversations around the funding?
I think at this point, not a lot of meaningful, well, I wouldn't say that. I think it's just all options are on the table at this point. I think there's not clear funding for this at this moment. I think the discussion we wanted to just start having across the board is this is what the impact would be if it was funded, and kind of make sure people understood that what the opportunity is here in terms of what this would look like
So this becomes a little bit of an advocacy piece then. Funding.
Yes. This is what it would look like. Initial legislation, I think you all know, called for money from either the JUA or an appropriation. JUA is largely settled, still working through some finalization, but some of the funds that were deemed excess were not. So changed the fiscal code last year and it cut out the JUA piece, still could be potentially subject to other. I think this is just informational on the impact that it could have based on modeling by, I think you work with an actuarial firm that looks at kind of the type of information, Colleen, that you'd be looking for. I mean, these big firms, you know how they work. They go all sorts of sensitivity testing and what impacts could happen to come out with a degree of confidence.
How has this been communicated or has it been communicated to the General Assembly and to the governor's office?
So this is pretty fresh. So we are sort of at the beginning of communicating all of these impacts. Because we were waiting to kind of see how open enrollment ended and then get a pretty quick turnaround on what that could mean for modeling. So our thought was to communicate this broadly to try to just provide information on what the impact could be.
I mean, I would urge us to communicate it explicitly as allowed to the General Assembly. Obviously, appropriations hearings are starting next week. And so knowing this, given how much attention is being paid to the increasing number of uninsured as a result of the expiration of the enhanced premium tax credits, knowing this is beneficial. Now, I will say the governor did not put this in his budget proposal. It's very hard to add things as opposed to taking things away from that budget proposal. But if there is a way to do it, I'll speak for myself. I'm not on appropriations, but we could probably get the question asked to Commissioner Humphreys to bring it up, but I don't want to put anybody in a bad spot. I think we need to communicate this to the General Assembly.
I think Devin and I kick off budget season on Tuesday morning is our hearing, and I anticipate healthcare costs being a considerable point of conversation. And I think Devin will present some through study what it would look like if it were to be.
So will you be presenting more than what you're sharing here? Like is,
Maybe next week.
yeah.
No, I think it would be sharing this information.
To let legislators know what the impact could be if we were to prioritize funding for the important. Other questions?
Is there anything that would need to be shared about the date that it would make the most impact? If known by X. I'm just thinking about also
Yeah.
the large, the timelines.
Yeah, I mean, I think, as Jennifer mentioned earlier, the insurers and the exchange have already implemented. I mean, that's this is pretty turnkey. I mean, not like next day turnkey, but pretty turnkey in that everyone has already implemented all the changes that would be needed to implement something like this. I think if it's tied to the budget season, that's usually something in July. I think we would have buffer times we would need, and then there's always certain dates before open enrollment that we would need as well. But I think if we were to know early enough, there's potential that we could start trying to bring people back in mid-year, and not have them go a whole year without coverage. But I think that really depends on avenues and timing and all those different pieces and operational reality of how quickly we could turn it on, and gets to a certain point where we're turning it on mid-year. We should just wait for open enrollment because there's conflicting resources there. So I think
That would require a vote on an SCP, right? A new SCP.
The earliest that we would implement funding for this is the end of June. And realistically, it'll be better than last year, but we will likely pass the budget sometime in early July.
Other questions? I know there's a second part of affordability that we need to get into this motion.
So the next part is on reinsurance, and this is one that we more kind of programmatic control over. So we haven't talked about this as much in a bit, but as we all know, Pennie contributes to the reinsurance program, which reduces rates for those full pay consumers. And so the insurance department is now working on parameters for that for 2027, which we would pay out in 2028. There's a very extended, it's like a 2-year gap between when we set the amount, when Pennie says, this is what we think we could contribute to that, and when we actually pay it out. But just given all the market changes, the population changes of who's insured from the federal policies, proposing here that we do add some money to what we contribute into reinsurance to help bring down the overall rates to the extent that we can use some of our resources to help feed a little bit more into that program. Just again, in recognition of the wide shifts, large shifts that we've seen. So we are proposing to kind of commit to a $60 million level, which is 10 million more than we currently have paid into it, which is 50 million for the 2027 year, which is being formulated now to be paid out in the 2028 year.
I know that's a lot, and that's, we've gone out to the carriers already with proposed filing guidance for 2027. In that guidance, we put in a very conservative reinsurance estimate as we model based on the data provide us in the data call that I think is due, I think tomorrow, actually. So then we'll go back through with our modelers to find out a range of impact based on what your claims say and how much we can impact premium and how much we can anticipate Pennie. So the ask from PID as part of this process was I think for Pennie to look at increasing the amount that we put in. The reinsurance program, obviously it was key to the selling point of the legislation that created Pennie several years ago, because it was looked at as both you help people and those that are going to be subsidized and those that are going to be unsubsidized. Devin mentioned this helps potentially those that are unsubsidized. At the levels that we've funded it so far, we're only able to move premium by 3.5% to 5%, I think has been at the high. Now, if we could get closer to more consistently 5 or above 5, I think that would be more impactful, particularly now as premiums kind of are volatile. So we were looking at it from a sense of impacting premiums for those without the subsidy, and also recognizing that we as a board created those different rainy day funds within Pennie, and one of them is for reinsurance. So if we could kind of look at that as an option to fund the reinsurance program.
That's a 6 budget item. 27 coverage year for 28 payout. Follow that right?
It's what we would commit to now, which would then feed into 2027 rates. And then we would pay it out in 2028 once all the claims have been processed.
And sometimes still subject to change based on how claims develop. Like I think last year we approved an extra $5 million, right? Because claims came in different than what we all anticipated, because there is this 2.5 year gap between when we try to estimate and when we look at how claims have developed.
Every other year below that's come in less than.
Yeah, it was the first year that it had to go over. And I mean, I think some of that, and you look at the numbers from 21 to 24, it was volatile. Part of that was COVID, and the federal government changing the calculations during the COVID year. So when we anticipated a more significant spend from Pennie, it actually dropped all the way down to less than $20 million for a period of time. And that actually goes to the creation of the reserve in the first place, how Pennie accumulated for the last couple of years. So we're trying to be more aggressive earlier in the process, I think, but still doing it from a conservative standpoint, because Pennie, we don't know what the next 2 years still look like. We don't even know what the full effect of this open enrollment look like. So trying to draw that distinction or balance between being a little more aggressive, but being conservative enough to anticipate future change.
And I was just gonna say, we've done a significant amount of financial modeling work. And it just, confirms our financial strength that, I don't see a problem with increasing the reinsurance amount, the 60 million in 2028.
questions or discussion on this piece?
Or do we know, like, so do we know, I know we won't know until all claims are paid for 25, but do we know? Do you have any early indicators? Is anything shared with you to know whether things are tracking to? Because last year, to the commissioner's point, we had to add additional funds. Are we tracking to what was budgeted for the payout for this year? Or is there a chance that we would have to increase that again? Do we know?
I have to go back.
Yeah, I think we. Sometimes I think your team, when you share when you have that kind of early indications, I don't know that we have those yet. I think it's too early.
Other questions on reinsurance?
Does the program kick in based on individual claims, or does it kick in based on whatever the insurance company needs? If they reach a level of payouts, that then reinsurance kicks in.
It's claims driven. We set the parameters at
Okay.
like between $40,000 and $100,000. Is where we've been, or 60,000 and 100,000, and then change the amount of reinsurance that's provided in that range based on how much money we're bringing to expect to help level the cost. All right. And I will note that, Dr. B is appointed, Evan Bettinger to vote for her as a proxy. She had to run to another meeting. So with that note, I would be looking for a motion to authorize Pennie to commit up to $60 million in contributions to the reinsurance program for the purpose of PID setting parameters for the 2027 calendar year. Representative Bencat moves. Second by Joel. Any further discussion? All in favor, say aye.
Aye.
Any opposed? Any abstentions? Hearing none, motion carries unanimous. Move on back to Devin for brief long-term outlook.
And look at this, at your leisure, but we just kind of mapped out the key things, the open enrollment changes that are looking at in-house call center and retaining uninsured sort of over the next several years, getting us to early 2022. So in the interest of time, we'll go through this in detail, but kind of wanted to lay out how all of those activities are happening over the course of the next months. So then moving us along into the proposed rule. So CMS put out their proposed rule last Monday. Typically, they just send out in November. So it is quite late. We have a 30-day comment period, so that's also quick. We had provided some, preliminary analysis in the materials for the board before the meeting. We've added a couple of other items here just because as we did additional analysis over the last week, we identified a couple of other items. So David's going to walk through the key pieces, but wanted to just mention that because of how quickly we had to turn it around, there's a few additional items in here. David.
Thanks, Kevin. For the touch on kind of the bigger the big ticket items, at least for us, in this proposed rule, and what we might want to potentially comment on. So the proposed rule, first thing is the proposed rule requests comments on the implementation of the pre-renewal and pre-enrollment verification provisions of HR 1, with indication of future rulemaking on this topic. So we're proposing to comment in basically two areas. One is to basically communicate that by failing to provide regulatory guidance on these very critical requirements that are coming soon, by failing to provide guidance now, it really left states in a bind in terms of having to start work on this without knowing how CMS intends to implement them. So, their failure to kind of provide us guidance is kind of leading us to, do what we think is right, but we don't know. And then, we're going to really reiterate that we need this guidance as soon as possible to avoid future operational risk, negative impacts to consumers. And then we'll be providing recommendations that future guidance provide for state flexibility to implement these provisions in ways that, prioritize reducing consumer burden and mitigate operational risk. Another big thing is we are getting a new audit starting in plan year 2027. This has been mooted for a while. But the state exchange and proper payment measurement audit is coming. We've commented on this in the past. It's a highly burdensome audit. We believe, will be duplicative of our current annual SMART audit. And basically requires us to do significantly more work already, subject to an annual federal audit.
You specifically asked for non-enforcement prior to any future rulemaking? I mean, saying that, hey, you're not giving us guidances, I think it's important. What's the ask that goes with it?
So I think the ask is, anyway, I think we still have to formulate this, and there's a lot of, that goes into how we make this message, but it's kind of like, well, you haven't given us guidance, we already have to plan for this. We're gonna move ahead, we have to move ahead with what we think is right, and if you come too much later and tell us, no, we want you to do this, it's gonna be very hard to do. Might not be able to do it. And I think being on the record now as saying that, that's a consideration of going on the record and saying that, if you wait too much longer, we're not going to be able to pivot. Change the guide.
We're specifically indicating that we would need final regs by July, which means they'd have to propose pretty much immediately, which I don't know that that's likely. And so I think that maybe laying that groundwork now, and then when they do eventually propose something, I think maybe stepping up the ask at that time of like, we said we needed it by July, this is clearly not going to be finalized by July. And then maybe recommend a more specific non-enforcement or extension period for state-based exchanges to implement. I think we were thinking just for this one, laying out that anchor of the timeline so that we could build up.
On the audit piece, is there a cost to Pennie just to support an audit? Or I'm just trying to understand, it may not be part of what we put in comments back, but I'm just curious as to if there's any financial.
There's a tremendous amount of, man hours, that goes into an audit. So there's the acronyms, I always forget what it stands for, but we're in the second cohort of states that are going through kind of what is the precursor to this new audit. And it's really just to provide CMS all of our data so that they can use it for this new audit. And it's taken hundreds of hours across the entire organization to provide this data. It requires us to look at all different types of eligibility and enrollment scenarios. And it's taken a lot of time. And this is just the preliminary before the real thing. So yeah, the cost is, it takes a lot of our time to do these audits.
You don't hire consultants though, like you're using the existing Pennie staff, so it's more so that it reduces your amount of time to work on other things because you're.
We have a consultant who does our SMART audit. For this new audit, it would be in-house Pennie staff. There already is cost to our agents. And then the rule also proposes several policies from the marketplace integrity and affordability final rule that came out last year. So these were either one-year provisions set to sunset that they've extended or are currently stayed in federal court. This includes burdens of income verification requirements, as well as failure to file and reconcile standards. Those are currently staying in federal court. We are going to just refer them to our previous comments opposing those requirements. I think the upshot here is federal court has ruled that they can't implement these changes. CMS said, well, we're going to propose them again with no changes. That's kind of where we are. Next slide. We talked about this a little bit, but the proposed rule will codify a new definition for eligible non-citizens to comply with HR 1. So again, this new definition would limit APTC eligibility to non-citizens and the specific lawful permanent residents, Cuban, Haitian entrants, or coastal migrants. There's not much we can do here, but we are going to comment on, we're going to highlight a projected increase to Pennsylvania uninsured and, you know, the potential negative impacts to risk pool. Imagine that younger, healthier risk is going to further leave the market, and that's been the biggest, I guess, upshot to what has been proposed and finalized already is that good, healthy risk is leaving the marketplace. And then we also would urge them to try to limit the operation.
Miles, get out.
I was still on mute.
Yeah. Please, you, I hope Miles got out of there.
So I think, you know, the proposed rule like requires us to just use a specific data source from the Department of Homeland Security. And I think that at least there's some concern about how efficient that data source is and how often it is updated. And so we're concerned about getting the right eligibility status back from the Federal Data Services Hub, as well as the right codes, because for the first time, not all lawfully present are going to be eligible for APTC. So there's going to be an operational lift there to conform to the proposed rule increases cost share requirements for catastrophic and bronze plans in ways that exceed the limits established by the Affordable Care Act. And, you know, we plan to highlight the ways that this would make coverage and care less affordable for consumers. The administration has promoted catastrophic plans as a way to reduce costs, but if cost sharing is so prohibitive, people aren't going to enroll in these plans at all. And again, especially, you know, younger people are going to further leave the market if you make it almost impossible for them to utilize insurance. And then CMS, there's been a consistent drumbeat of, you know, all this fraud is going on in the marketplace, and a lot of it is perpetuated by brokers. As we've talked about, we have a program integrity kind of unit that is really designed to identify cases of fraud and take action specifically against bad actors to preserve, you know, the market for all of us. However, kind of contradictory to that premise, CMS is proposing to allow states to exclusively utilize enhanced direct enrollment, which would allow agents and brokers to effectively monitor or to effectively, I guess, do eligibility and enrollment. It doesn't directly apply to us because we're not an EDE state, but we're highlight the reasons why states have not gone this way. It's because, you know, having a centralized eligibility and enrollment platform gives us, you know, that control as a fair, unbiased actor, and going full EDE would make it effectively that much more difficult to monitor potential progress.
So those are the key provisions that we are proposing to comment on. And as we have in the past, looking for approval from the board to submit in line with these, you would, you know, draft the exact language and all of that. But, you know, conceptually, this is where we would be interested in commenting.
Will you circulate a draft for that? We'll see a draft.
Yeah, I think we did last time, especially with such a short comment period, is I think we sent out a draft a week before it was due and asked for comments back. Before any feedback back. I don't think we heard anything last time and we just submitted it by the deadline, but I think we would attempt to do something similar this time.
I think the idea, and correct me if I'm wrong, like we'll send it out for comment. Members should respond directly back to you all because we can't comment to each other via email. I mean, it would need to be public. So if there's substantial changes, then Anna would send it back out to us to kind of get final thoughts versus like a running email chain of events.
Yeah, that's correct.
And then I think, you know, with it being in line with a vote, I think it would be, if we didn't hear anything, we would assume moving forward, we would submit it. That's what we did.
I don't remember all the specifics of this, but I thought there were some things too in the new rules that were going to limit the state-based exchanges oversight or like their ability to do certain things, but I didn't see any of that. I thought that, I know there were some folks on our side that said that were kind of pointing some of those things out. Were there, I don't remember the specifics.
There are significant changes to network adequacy standards. I don't know if you're talking about Brandon. Then it would also to allow qualified health plans that have no networks to be certified. So I don't know, that's what you're,
It was more like state-based exchange, like having your direct authority or oversight. Also, I don't remember the specifics. So maybe
They made some changes to onboarding as a new state-based exchange for the most.
it's just for new and not for existing. Okay.
David, those two you just mentioned, those are option, those weren't requirements.
no, I mean, we're not planning on commenting on those just because they're not most relevant to us and most, I guess, prescient for us right now.
No, I would be surprised if the insurers felt like they knew enough from the proposed rule to run a no network plan or a 10-year cap plan based on the data that was in the reg itself. It doesn't know how you would actually do that. So I think they would need to provide more clarity in a couple of key ways in the final reg, which will be too late for a company that's not already been planning to do it, to introduce a product by May 15th.
And we didn't include that here because Penny is not involved in network adequacy reviews. That's all in the department. So that's sort of why we didn't propose commenting on it, and it's huge, a bit vague.
But also, isn't it, I mean, state-based exchange, don't have qualified. They don't need private that, huh? I thought that.
That might be the case. I have to look into it. I'm not honestly sure.
Yeah, that's too, there was like, you can do this, but you don't have to. Right?
Yeah, for the network, yeah. That
For
might
the
be-
reference-based pricing. Essentially.
Okay, so we'd be looking for a motion to authorize Penny to submit a comment letter to CMS in response to the proposed NBPP, consistent with the approach that we've talked about today, which would be Penny staff sending out the draft for Penny feedback and then final. So we're looking for advanced approval of submitting that letter.
Make that motion, Amy.
Is that motion? Do we have a second?
Yeah, Ellen?
Second, any further discussion? Did I cut you off? All those in favor say aye. Any opposed? The abstention. Motion carried. I think we have one more agenda.
And that, by the way, that does apply only to, we don't have state-based exchanges, don't have.
Right. Last item, this was alluded to earlier about requesting additional funding for some marketing. So I'll turn it over to Heather and Tashi to run through this section in the last 10 minutes.
So we spent a lot of the afternoon talking about the forward outlook for the organization. We're going to take a look back to last fall when we were uncertain about the extension. So in October, this board approved 2 different budget versions, which were contingent upon whether the tax credits were extended or not by the end of the year. So since the tax credits were not extended, we implemented the basic operations budget of 115.7 million. And also back in October, we discussed revisiting additional funding needs during this February meeting. So now the enrollment is complete, and our enrollment is exceeding our original projections. Penny is in a strong financial position, as I noted in the next slide coming up. So basically, we find ourselves with an opportunity for the board to consider some strategic projection strategic investments to support awareness efforts and sustain enrollment. I'm now going to turn it over to Chachi, and he's going to discuss this opportunity for your consideration.
Yeah, thanks, Heather. And I think a lot of the points that are on this slide kind of already touched on is that with EPTC not being extended, our kind of target demo and who is most eligible for those tax credits is shrunk, making it a little bit harder to reach them. And then also educating the general public on the new open enrollment dates and there only being one deadline to enroll. So to kind of be able to reach these folks, we are asking for an increase in our marketing buy. And on the next slide shows a little bit of how you see this additional funds being spent. One on updating our creative. So our campaign of You're Worth Protecting has been kind of in place since the unwinding. I think that now that we're in a new paradigm, it gives us an opportunity to freshen up our creative and our campaign, and update our informational commercial, do more of an awareness and a branding commercial, and then capture some Pennsylvania specific video and photos. So it really solidifies the fact that Pennie is for Pennsylvanians. And because we've been using a lot of like Getty stock image up to this point. So we'd really love to be able to have a good library of Pennsylvania landscape, but also Pennsylvanians. On the advertising buy, you can see that how we perceive that kind of being broken out as well. In talking with our media buy vendor, seeing what that translates to. So that's 2.5 times more impressions. An impression is just how often somebody sees an advertisement, but then 150% increase in views, clicks, and website traffic. And in Heather's first slide, one of those bullet points mentioned that a lot of the cuts to our budget was from the marketing buy because it's just an easy one to kind of scale up or down. And that's really kind of putting a lot of those funds back into it. So our media buy without this additional fundings would be around 3.5 million. Adding this in would give us right around 8.8. And for comparison purposes, we were at 5.5 million for this past open enrollment. A lot of things we've already kind of touched on, but going into our year 2 of our 3-year growth plan, expanding out to some more high priority zip codes. And based on what information we get back from our new uninsured survey, hopefully be able to double down on some of that language and be able to use our data to find these Pennsylvanians that are most likely eligible for tax credits. I'll just put a period there, eligible for tax credits. And then if there were to be a state subsidy funding, this budget also allows us to kind of get the word out on that as well. So be able to quickly ramp up to any positive policy changes. We also highlighted that we got a lot of media attention this past open enrollment, which was valued around 8 million in basically free brand mentions. Don't expect that to happen again this year. So this media buy kind of helps supplement that attention, and then amplifying the OEP dates. So I think that I've mentioned a lot of the bullet points here, and then I'll stop there for any question. I know that right on Colleen's point,
Pre and post election.
right, this wouldn't be the first open enrollment that we've had to counteract political.
It's a lot longer when
It
it's
is.
like 8 days versus weeks.
Yeah, that's a good point.
Yeah.
What we would do, and I think having a plenty of early planning on this would be really vital, but like we would buy and secure more out of home, like billboards for transit, secure all of that stuff early. So that's in market, but then also lifestyle stuff. So we've tested like gas pumps in grocery stores and those types of, so we would secure that nice and early. And then and then also go hard more on the digital buys, because those rules really affect more of broadcast laws and cable laws. But we would be able to use that additional funding because there's not inventory constraints on like streaming TV and online advertisements. We would be able to buy up a lot of those and be able to target our audiences more specifically. So it would be more traditional in the sense of like billboards, transit, lifestyle ads early on in open enrollment. And then once we get past the election, go hard more on TV and broadcasting.
My only concern with just billboard and some of the broader stuff, it's not trackable. Like you're not gonna
True.
know whether it had an impact or not for the extra dollars we would be spending. So, you know,
Yeah, I mean, you're always weighing against awareness and action.
when we go back and look at the slide, I don't know, they're not, at least if it's numbered, my page number, it's cut off on the printout, but like we had a ton more impressions that we saw, but then the action rate for almost double the impressions, your action rate was less than 30,000 more on the action side of things. So I think that's the piece that we just have to make sure as we're looking at the ad spend, how are we making sure that we're driving the action? And do we have the opportunity, especially for, I guess if we're going to look at any upside to disenrollments, to your point made earlier, Devin, like, who these people are, where they are, like, how do we do more of that specific targeting and more of win back strategies as opposed to trying to boil the ocean with all the broader, hoping that because I think at the end of the day, we have a lot of people seeing our ads that probably get their coverage through an employer or somewhere else, right? So how do we balance those two things? Are there ways in which to do modeling as well so that we have a better picture? I don't know what modeling we do today. I think we looked at some stuff a while back, but like, how are we really modeling out what the uninsured population looks like? I think it's changed considerably. We've done it before. I just want to make sure that with the spend that if we were to approve additional spend, how do we make sure it's really hyper focused?
Yeah, that's kind of year 2 of the of our growth plan is one, now that we know who has terminated, we can kind of make lookalike audiences to those populations, knowing that we can kind of retarget them and have them come back, on our own communications and direct communications. But duly noted of, doing our due diligence to make sure that these dollars are being spent appropriately and we're getting the proper return on investment. But we know where the highest population of the uninsured are, and the additional creative budget allows us to get really specific on some of that creative so that we can speak directly.
And I guess some of it too is also looking at who actually purchased this year to understand who where dollars are not, where we don't have the subsidies, what was the population that actually could afford it? Because if we're also looking at that uninsured, it may be, I don't know what the win back opportunities are for there. Maybe that's more when it comes to if we do have a state-based subsidy, but who are the people that actually could afford it? And we won't have a ton of data as to how long they stay on. I guess that's another population that we should be looking at. Is anybody that came on new? Where do they live? What do they look like? How do we attract more of them that may be able to afford the coverage and come on versus, that we lost, or it's a combination of those two things. I guess I'm just trying to push on the fact of being a little bit more precise in who we're trying to target as opposed to broader based channels that may be costly that we can't track, don't know the effectiveness of. And
I think what we saw with our new, at least from the surveys, again, like we want to do more of them, is that they were coming from other coverage. So I think that indicates a churn, and that's why we want to make sure that we have the Pennie name out there so that when they do need us, they know where to find us versus, because I agree the uninsured or the long-term uninsured, if they couldn't afford it already, it's going to be a challenging proposition to them. But if our target is more like this churning population, to make sure that they know where to go when they do lose coverage, since that at least preliminarily, looks to be where we're getting a lot of our new enrollments through, making sure that we have that out there to get to swoop them up. And then I think, to the ROI point, like we really did see a lot of effectiveness in our ability to target and kind of lift enrollment in areas, like back to the other slide we were showing earlier, to lift in enrollment in areas that we really did focus our marketing on. So I think with additional money, we can do that targeting in more areas and hopefully try to lift up awareness and that less enrollment in those places.
And Rob said he was gonna go over to everybody in Luzerne County and see what was the deal there.
If you saw the termination rates, they're not bad to start, right? So I can probably handle it.
Any other questions?
And this is strictly all media. Mark,
This would
That's a
be,
big
be paid media and some creative. That's
It is a big chunk.
And just sort of bringing it back in line, that was the main cut we had, and sort of just bringing it back to. And then on the last slide that you guys have, it does show that we feel very comfortable from a budget perspective. We still think that we would have, like given the stronger financial position than we would put our worst case scenario, we think we're well in position to be able to accommodate this and still have some buffer for anything unforeseen.
You guys feel like you have robust testing of areas that are getting TV, not TV, that you are measuring? No, I haven't been here for as many.
Yeah, we've been really, especially in the TV market, really heavy more in Philadelphia and in Pittsburgh. But with this additional fund, it gets us into broadcast TV and specifically where we would.
But we could have a like media, like a screen and somewhere like.
Yeah.
Questions? All right, then
I
we.
guess there's just I guess the one, I'll just, this one, like, do we have an opportunity where it's say, yes, we can, if we were to say yes to this funding vote now, can we see the more detailed plan later so that before we actually pull the trigger to spend, we're all, feeling comfortable with where all that's gonna go?
Like,
I mean, I don't know what everybody else thinks, but.
Because our next meeting is when?
May.
May.
yeah, we would have a.
Pull something together on general basic expenses. Yeah.
Yeah, I think if we had the approval on this today, that would allow us to put together the plan specifically with that budget in mind, and then bringing that back in May. I think if there were discussion around concerns or tweaks to that, like we would be able to have that discussion or locking everything. Right, Tachi, that timing.
Yeah, that'd be great. May's turn around by then.
Yeah, I was just gonna say, it's always hard to second guess because you're in a better position to know what you're looking at. So I'm hesitant to do that, but I do think having a little more color would be really helpful. So it's more than double. It's big, so.
Yeah, and again, our target market, it's sad to say, but we've priced people out. It's not for everybody. So we've got to really do our due diligence and finding those that are eligible. And that's, unfortunately, that does take money.
And if we're successful, I mean, goes without saying, but if we're able to get more new people in, it helps just continue to keep our budget strong.
Looking for a motion to authorize additional funding in the amount of 5.5 million to increase 2026 for creative and advertisement services to reach out to uninsured populations in markets with Pennie staff to cover the downs. Do I have that motion?
So
Cheryl moves. Do we have a second? Joel seconds. Any additional conversation? Hearing none, we'll call the vote. All in favor, say aye.
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 Opposed? Hearing none, motion carries unanimously. We are now at 3:05. We will go ahead and adjourn the meeting. So thank you all for joining us virtually. Certainly everybody in the room for sticking around today for another productive strategic planning. So thank you, and we are adjourned. Now, are we off?
Not yet.
Yeah.